Hydroflux, Redefining Your Lifestyle presents the return of the Singapore Parenting Festival. Join our amazing hosts in a series of 8 free webinars that cover fertility and pregnancy concerns, parenting tips for newborns to fussy eaters, living with COVID and vaccinations, and guides from preschool to PSLE. Register now and attend our webinars for your chance to get an exclusive SPF goodie bag while stocks last. The Singapore Parenting Festival is proudly brought to you by MediaCorp and the Asian Parent. Platinum Partner, 100% organic drip chicken essence with cordyceps. Gold Partners, Dumix Dugrow, comprehensive nutrients. Scott's Vitamin C for kids' immunity. Nature One Dairy, your partner in parenthood. PCF Sparkle Tots, we sparkle lives. And the following silver and upper partners.
Hello, everyone, and thank you for joining us this evening for the Singapore Parenting Festival. We are proudly presented to you by the Asian Parent as well as MediaCorp. We'd like to also acknowledge all the different partners for the festival, and let's introduce them to you. The Platinum Partners are Hydroflux, Eu Yan Sang, Gold Partners, Dumix, Scott's, PCF Sparkle Tots, Nature One Dairy, and also not forgetting our Silver Partners, Ministry of Health, Singapore, Baby Dove, Virtus Fertility Center, as well as Prudential. Also, our content partners, Center for Fathering, Mums for Life, and Dads for Life, and Baby Pass. The Singapore Parenting Festival is glad to bring you exciting contests, as well as informative webinars like this one, as well as a grand sale. And today, we will be diving into the topic of living through a pandemic, how to protect your family. But before we go further, a couple of house rules just so that we know what is to come. Now, in order for our speaker and panelists to address the questions most pertinent to our topic of discussion today, we would like to invite you to post your questions via the Q&A function right at the bottom of your screen. Now, we regret we won't be able to accept questions in the chat box. And also by the end of today's webinar, there'll be 6 of you who will be walking away with a $50 Shopee voucher each. And you can buy a lot of things with $50, especially with inflation. You'd like to get all the stuff that you want earlier rather than later as well. Now let's also look at this next QR code that we're just about to show to you. This is where you quickly get your phones, scan the QR code because you want to be the first 150 to walk away with an exclusive Singapore Parenting Festival goodie bag. It's while stocks last, so quickly scan. Good evening, I'm Stanley Leong from CNA 938, part of MediaCorp. Thank you for joining us today. I'll be your host. All right, right now to invite and introduce our guests, our speakers, as well as our panelists for this evening. First up, we have Associate Professor Raymond Chua. He is Deputy Director of Medical Services at the Health Regulation Group and Assistant Commissioner for Cybersecurity Healthcare with Singapore's Ministry of Health. Now, joining us on the panel this evening, we have Dr. Chan Tze Min, and she is Head and Senior Consultant with the Division of Paediatric Infectious Diseases at Khoo Teck Puat National University Children's Medical Institute over at the National University Hospital. Joining Dr. Chan on the panel is Professor Vernon Lee. He is Senior Director at the Communicable Diseases Division at the Ministry of Health. Apart from our medical experts, we also have a mother with us, and she's going to be sharing her own journey of having a child who contracted COVID-19. Later on, we'll be meeting Jacinth Liew. She's a parent coach, mother of 2, a 7 and a 5-year-old, and we'll be hearing her experiences of having a child living through COVID-19 for a short season. And once again, a reminder that you can post your questions along the way in our Q&A box right there below on your screen, and our guests later on will do their best to answer them. But before we go further, let's do a quick poll here, shall we? We've got 2 questions. We just want to know who is joining us for this webinar. Now you can see the 2 questions. The first one being getting an idea really of the children that you have, the age groups that they fall into, the bracket. So indicate, if you can, the age group that your child falls into. Now, if you have a child who is beyond that age range, either younger than 4 or above 12, you can click the third box. And also, with regard to child vaccination, we want to know where you stand on this as well, your comfort levels. If it were your child's turn to receive a COVID-19 vaccination, how open are you to letting your child receive that vaccine? Click yes, no, undecided. We just want to know where you stand at the moment. And while you do that, a very quick check with our guests today. Let's begin with Professor Chua, Professor Raymond Chua. Professor Chua, COVID-19 has been around for just over 2 years now. Tell us more about whether or not we have sort of found a steady state in Singapore. Are people as anxious these days, you think?
Hi, Stanley. Hi. I think in terms of, I would say the steady state, the level of awareness and preparedness amongst our parents, as we have seen in the ministry, has since actually improved over the years. As I think we have pushed out more information, through our social media, through our websites, as well as even through a lot of communication materials, such as the electronic home recovery program book that I will flash the QR code later. I think with all this awareness, the level of anxiety has definitely gone down, especially as we move towards the endemic state. I think, but we do know that our healthcare protocols have also been changing. And I think that's why, this webinar will be good in terms of trying to refresh some of the knowledge and the latest information about how do you deal with COVID-19 protocols, in dealing with your kids if they are infected.
Right. And even though we may be at a steadier state, if you like, we still have a lot of questions because just based on the number of participants who have joined us for this evening's webinar, I believe it's the highest number of webinar participants for this year's Singapore Parenting Festival. So I think we still have a lot of questions to go through, and I'm just looking forward to the Q&A segment as well. So while you're doing the last few entries there to participate in our poll, also want to quickly check in with Dr. Chan, because Dr. Chan, you're on the ground at the NUH as well. Are you still seeing a lot of parents coming up with a lot of questions for you, Dr. Chan?
Hey, Stanley, thanks. Yes, we are still seeing a lot of parents come with questions. I think, when parents find out that their child has COVID-19, they panic. It's confusing for them. They don't know what to do. I think there's lots of different avenues for information, and what they hear from one friend is different from what they hear from another friend, which might be slightly different from what they hear or read on the websites. So they do have questions. I think most of them fall into similar categories about what to do with their child, what to do with the rest of the family, when can they go out again. So hopefully we'll address some of these questions today here.
Yeah, I mean, how long should they stay in isolation? What should parents do when the child is in isolation? And I'm really also very curious to find out the experience of our mother guest who will be sharing with us about what the experience was like when her son had COVID-19 and the number of days he had to spend in isolation. What do you do with a child who has COVID-19, having to spend your time alone in a room? It sounds like punishment to me, if you ask me, but I don't know. We'll find out later on from our guest. All right, if you haven't done the poll, very quickly, because we're going to be closing it up very shortly, and we'll be moving on down our program. And just a reminder also that you can redeem that free goodie bag earlier on. Hopefully you've scanned that as well to be able to submit your particulars, and then you'll be, if you're among the first 150, you'll be getting that exclusive Singapore Parenting Festival goodie bag, all right? And don't forget your questions along the way. If you have one now as well, we invite you to submit it in the Q&A box below. All right, the poll results are out. Looks like most of our parents here have children who are in the younger age range of 5-6 years old, followed by those of us who have children 4 and above, and or maybe younger than 4. And also we have parents of children, lesser of you who have children between the ages of 7 and 11, the primary school going years. And also, will you let your child receive the COVID-19 vaccine? Majority of you have said yes, some of you no, and we also have some of you who may be a little bit undecided at the moment. So let's see how we go after the webinar is over and see if we manage to address all your concerns. Right now, I'd like to invite Associate Professor Raymond Chua to address us on the topic that you've all joined the webinar for, living through a pandemic, how to protect your family. Professor Chua, please.
Thank you, Stanley, and good evening, parents and viewers on this webinar. So thanks to MediaCorp as well as the Singapore Parenting Festival Organizing Committee for inviting MOH to speak in this webinar on how you can protect you and yourself in your family as we start living with COVID. I think, first of all, let me apologize, that I have to wear a sunglass at this moment in time, not because I want to act cool in front of the parents or the kids who are tuning in. But I think I have conjunctivitis and red eyes, and I think I don't want to scare, the viewers of my scary red eyes, at this moment in time. So so please accept my sincere apologies. Let me just start by giving you an overview of the COVID-19 situation amongst children in Singapore. I think over the past few months, we have actually collected, some of our data, and we can see that next slide, basically the highly transmissible Omicron variants have actually led to high infection rates amongst our children. Next slide, please. So you can see that amongst the children below 12 years of age, we are looking at about an average of about 250 cases per 100,000 population itself. And I would say that, between those that are age 5 and above is slightly more, I guess, because of the higher level of activities amongst them, but it's definitely not that much higher, from the 5 to 11 compared to the 0 to 4. We have actually seen that most of, I would say majority of the children actually do get very mild diseases, and the risk of them getting very sick from the COVID-19 is actually very small, but definitely nothing is impossible. So, definitely it's not absent. I think some of those that have infected with COVID-19, we have seen a very minority, and you have read from the newspaper that some of them would have developed some of the late complications, such as the multi-system inflammatory syndrome in children, and some may even require some form of treatment in the ICU. But other than that, most of them are mild, unless the child have any predisposition, conditions such as high blood pressure or diabetes, then they will be more likely to develop some severe complications from the COVID-19 infection itself. And as of late February, about 57 of our hospitalized patients are children under 12 years of age. Next. So in terms of the healthcare protocols, I just give a very quick overview. If a child is unwell, and I think most of you would have known about the protocol 1, 2, 3, which we have streamlined and make it simpler. So protocol 1 basically means that if someone is unwell and requires a form of medical attention, basically the first thing to do is, I think you should inform some of your close contacts so that they can test themselves, which I'll elaborate later. If they are unwell, you can actually consult a primary care doctor or request a video consultation through a telemedicine provider. And I think what happens is, because most of them are very mild, we would say that actually you can be treated by your primary care or family physician. And therefore, if you want, you can actually go to this website called flu.gowhere.gov.sg, in terms of where you can actually seek medical attention. And I would like to emphasize at this point in time that actually there's no need, for any parents to rush to the emergency department just to get tested when your child is feeling unwell. I think you only bring your child to the hospital if he or she has any severe symptoms, such as chest pain, difficulty breathing, and I'll give through some of these later. But why we advise so is because actually the emergency department should really be reserved for those who require emergency care. And therefore, we don't want our mild symptoms patients to go to the emergency departments, to crowd the emergency departments, such that those who don't require acute care may get compromised. So I think, after the doctor has actually assessed you, the kid, then they will determine whether you can actually stay at home. On some of them, which are more severe after, the PCR results are out, they may also be sent to the COVID-19 treatment facility or the hospital, depending on what advice, the GP give. And and for those who are on home recovery program, if your GP is not available, then you can also consult a telemedicine provider. And this is the link that you can actually reach out to your telemedicine provider.
Professor Chua, I'd like to also find out about your thoughts on how there were earlier news reports about very long lines at clinics, but we hear that now there are extended clinic hours. Tell us more about that.
Yeah, so I think over the past few weeks, we have actually seen that the EDs, the clinics sometimes do get overloaded, and therefore to alleviate the load amongst the emergency department as well as also across the clinics, we have extended the hours. For selected public health preparedness clinics, we have extended the hours for weekdays. Some of them are extended up to 11 p.m. For weekend afternoons, some of them open from 2 to 5 p.m. or weekend nights from 8 to 11 p.m. I think, some of the polyclinics are also open on Saturday afternoons or Sunday mornings. I think with the longer number of hours, we would like to spread the load out such that it will prevent some overcrowding. And similarly, you can find the list of clinics which have extended hours at the flu.gowhere.gov.sg website. Thanks. Next slide, please. So I think if you suspect your child has COVID-19 and they have symptoms, first of all, after bringing to the GP, you can actually isolate your child. Test your child using an ART kit first. If your child is tested positive, I think if they are asymptomatic or if they are very mildly symptomatic, like for example, if they just have a very slight running nose and all this. Actually, the other alternative is if they are not that unwell, you can actually also allow them to stay home and recover under Protocol 2. So there are two alternatives. One is after you've done an ART kit test and it is positive, you can actually stay home and recover under Protocol 2. If you think that they require some form of medical attention, then you bring to the GP, and then then the GP will assess you accordingly. I think this is where, again, I would like to emphasize that there's no need to rush to the A&E, and even if you go to the A&E, we have actually put in place a mechanism in which we will also bring some of the patients who have been assessed not to have emergency symptoms to be diverted to other primary care clinics, for further assessment.
Right. So it looks like Professor Chua, our child may test positive, but it doesn't necessarily mean that he or she is going to be contracting severe symptoms if he or she doesn't fall under a high risk category, like you mentioned some of the chronic pre-existing conditions as well that may exacerbate the situation.
Correct. So I think in terms of the high risk individuals, how we would define high risk would be those that are actually under 3 years of age, or those that are under 12, which have some congenital conditions, or if they have some form of heart-lung diseases, or diabetes or hypertension, or if they are on any medication that affects the immune condition. And since most of our viewers are mostly parents, I think, I would say that, for those that are low risk, from 3 and above, actually most of them exhibit very mild symptoms and can be managed by our family physicians or the GPs. For those that are below 3 years old, the GPs may then decide that if you are if you can still recover at home, but the care will be provided by the telemedicine provider, or a community pediatrician, which MOH will allocate you, and then they will review the kit, based on when they are inducted into the home recovery program. And the only ones that actually require to go into the hospital will be those that are under 3 months of age itself. So that there are some risk category that we have put on. In terms of isolating with your child, I think some of the parents are also very anxious and wants to know whether they can isolate with the child. And I think, you can isolate with the child, but to further protect yourself, you should actually monitor your health at the same time for 5 days, when you're isolated with your child. And you should maintain also good hand hygiene, regular disinfection, and also maintain, good ventilation at home and reduce any interactions with other family members that are outside of your household. I think if you have anyone who is vulnerable, such as 80 years old and above who are not fully vaccinated, staying in the same household, then what we will also advise you to do is you can actually inform your GP, and then they can make further arrangements to move, yourself out into another care facility so as to protect the vulnerables in your same household.
Professor Chua, so while our child is in isolation and when they have recovered, do we need to, say, produce a recovery memo before we are able to send our child back to whether primary school or preschool or even secondary school?
No, so we're actually informed and worked with MOE and EGDA, basically to say that actually the schools or the preschools need not require any medical certificate or recovery memos, from the parents or from the kids itself. What we have actually worked out is that, if the child has a positive ART result, take the ART result, have a photo, send it to the school teachers, and let them know that you have a positive result. I mean, as a good practice, we have also asked people to put in their names, the dates that the ART test is taken, and, to show that as a proof. Once it's a negative, you can also use that as a proof to show to the school children, show to the school teachers that the results have turned negative. Yeah, and I think, one of the other things that we have also heard concerns about is that we also know that some parents will say that, well, if I stay at home, how would I get my results of the kids documented? If they are very well asymptomatic, and they don't need to go to the GPs. So we have also incorporated one other, avenue in which you can also go to a quick test center or combined test center to do a supervised ART test. And this is the link there. And once you do the ART test, if it's positive, again, you'll get into our national system and you can get yourself, get the results of your kids documented within the national system without going to the GPs to do so.
Professor Chua, also just a flashback as to symptoms. What are considered mild symptoms? We're talking about severe and mild. What is mild?
So the next slide basically will show to you, what are the mild and severe symptoms. I think in terms of the mild and severe symptoms, as it's like a flu. Basically mild symptoms are like flu where you have fever, low-grade fever. Next slide. Cough, sore throat, I guess, for kids, sometimes they may have some mild diarrhea, as well as also some body aches, but these are really what we consider as mild symptoms. And all this can actually recover at home or under the care of a general practitioner. What we consider then as severe would be if a person has a shortness of breath, the kid tells you that he has some chest pain, or if there's a persistent diarrhea, vomiting, or if, some of the young kids, they may not retain very well and they may be dehydrated, and that can be shown in terms of poor urine outputs. So if after some of these mild symptoms, and if you note that the child has prolonged symptoms, like for example, let's say a fever of more than 3 days, and it's still not coming down with paracetamol, it's still 38.5 and above, or worsening symptoms, then please go and seek medical attention. And then similarly, the doctor will assess accordingly. Next. I think this is the one that I was talking about in terms of protocol 2. You can actually self-recover at home if you are very mild, no symptoms, and tested positive. Now let's talk about the isolation period, where I think a lot of parents have questions about. I think the isolation period now, we have streamlined to say that for those that are less than 12 or fully vaccinated, you only need to isolate for the first 72 hours. After 72 hours, basically, you can actually do an ART test. And once the test is negative, your child can exit self-isolation and start resuming normal activities. So you take the ART negative test and tell the school teachers that, they have the ART test is already negative after 72 hours. If, let's say, the ART test is positive, and there are some instances of which, we know that, the ART test can remain positive after 72 hours, continue daily ART. So if you have after 72 hours, do on the 4th day, do on the 5th day, and once it turns negative, similarly, you can exit self-isolation. But let's say, in the instance where you continue 4th day, 5th day, 6th day, and it's still positive, then on the 7th day, if your child is fully vaccinated and or age below 12 years old, you can exit self-isolation, without a further test. So you don't have to do a test at day 7 again. If the child is not fully vaccinated and age 12 years and above, then you have to continue daily ART until it's negative or exit self-isolation on day 14 itself.
Right. Professor, what if the child does test positive for the ART but is feeling well? Do we still have to make a report, say, to MOH?
No need. So there's no need to report anymore to MOH, in terms of the results itself. All you need to do again is to test, take the results and then show it, to your school teachers, before you go back to school, and to let them know that actually, the result is already negative.
All right. So here's another scenario. For instance, if I'm fully vaccinated and I test positive, and if I continue to test positive, like you say, after day 7, do I still have to be stuck at home? Can I go out?
Actually, after we are saying that the exit of self-isolation at day 7 or day 14 is automatic. So there's no need for you to do any more ART tests after day 7 or day 14, depending on your vaccination status and your age. But let's say, you're fully vaccinated or you are below 12 years of age, you don't have to do an ART. At 12 noon on day 7, basically you can exit self-isolation, because most of the time, from our local data, we note that at day 7, most of the patients would be, most of the kids under 12 years old would already be non-infectious. So there's no need to do an ART test at all. Next, if let's say, if you are not a patient, but a close contact, you will be receiving what we call a health risk notice. This is different from what you have heard before under Protocol 3, where it was a health risk warning, in which you have to do 7 days of health risk warning. But since a few weeks ago, we have actually streamlined this, and now we have termed it as a health risk notice, because I think as we move forward, there's a need to make sure that we promote more social awareness, civic mindedness, as well as social responsibility, and we do not want to impose too much, legal impositions, on the close contacts. What we want is for all close contacts now, if you have been issued a health risk notice, through the SMS, take an ART self-test. If your ART test is negative, you can actually resume normal activity for a day. Before you go out of your home, similarly do an ART self-test. Negative, go out. Positive, if you are well, follow Protocol 2. If at any point in time you feel unwell, or you need any medical attention, then you follow Protocol 1. In some instances, you may not have been served a health risk notice, and your friends tell you that, my kid, is positive. You may have been in contact with my kid, a few days back, and if they're not so, similarly, monitor your health over the next few days. Similarly, if you're well, and still worried, then take an ART self-test before leaving home. If you feel unwell, similarly, follow Protocol 1. I think this is how we have constructed the archetype. Protocol 1, unwell. Protocol 2, well or mildly symptomatic, you can stay home. And Protocol 3 is really for those close contacts. And depending on, what's your test and what's your symptomatology, you can follow Protocol 1 or 2 accordingly. So I think, as I've gone through the healthcare protocols, 1, 2, 3, I think what we really hope for, and I think a lot of parents would, also want to ensure, is that, the child don't get COVID itself. But in the event, if so, I think vaccination does reduce the risk of getting infected. I think the next slide will show that, and I think this is also in our communications. Basically, vaccination still remains the best, chance of protecting our children against the infection and serious illnesses. So if you do so, basically once you vaccinate, you protect the kids, you protect your family, you protect the community, as well as also the educational institutions that they go for, and make it safer. So let me just go a little bit, into the vaccination of children. I think, we note that the vaccination of children have been approved for those that are aged 5 to 11 years. 2 doses, 21 days apart. Those will be 1/3 that's been used for adults from 12 years and above. So it's 10 micrograms. And I think from the trials, that have been done by the pharmaceutical company, basically has shown that it has a very strong efficacy of at least 90% against symptomatic infection. And there were no serious adverse events, that were related to vaccination for this group of children, in itself. Similarly, we have also done a very small study of 150 children locally, in which we wanted to study what the operational aspects of vaccinating young children are, and to also understand, whether the vaccination can create certain form of immune response amongst our children, and what the waning, of the immunity will be like in the longer term. I think interim analysis of 50 cases thus far have shown that after the Pfizer dose itself, it has actually demonstrated quite a very good high antibody levels, which means it's high immunity against the infection, as well as also, the rate of adverse events have also been very, very low, and in fact lower than adolescents, and with none that's requiring medical review or hospitalization to date. Next one is on booster dose. We know that booster dose for adults, from 18 years and above, we have actually, promoted that everyone should be boosted. If not, from 14th of Feb onwards for adults, you will not be considered as fully vaccinated. If your last dose is 270 days from your last dose itself. I think for the kids, we have actually going to introduce this from 14th of March onwards for those that are 12 to 17 years of age, similarly to protect this group of teenagers. So from 14th of March, those 12 to 17 years will definitely need to get their booster dose within 270 days after their last dose in order to retain their fully vaccinated status. And I think we have note that for those that are above 18 years already, close to 2/3 have received their booster dose. So this is something that we will introduce, and I think we will have more of this information going out from in March. I think one of the other questions is, if they are fully vaccinated but they get infected, what do you do? Do I still need a booster? I think, we are saying that those children that are above 12 years, if you still get infected, unfortunately, then you can still receive a booster. It's safe to get a booster dose, and basically you can do so from 28 days after the infection itself. So we are not saying that you should not receive a booster. In fact, we are saying that you can still go for booster dose from 28 days after infection, although we still recommend that you do so 3 months after the infection, so that you can get a better effectiveness from the booster itself. And I think, one of the things is, of course, to inform your child's close contact at schools. Yeah. So I've rounded up, just a quick overview of the healthcare protocols, the effectiveness of the vaccination and booster. And if there are any questions, I think we can take some of these Q&As later on during the Q&A session. Thank you.
Thank you, Professor Chua. Once again, our listeners, viewers, should I say, please take note of the URL there on that bottom of the slide. If you have any more questions, concerns about vaccinations, boosters, that'll be a good website to get onto as well. Professor Chua, thank you again so much for addressing many of our concerns and how we can clearly manage our children's health better. So I'm now to hear from Jacinth Liew. She is a mother of 2. One's a 7-year-old and the other is a 5-year-old. And Jacinth had lived through a season when her son was infected with COVID-19. And she's kindly carved out some time to share with us that experience, which I assume must have been very anxious times, because I believe that was even before Omicron became a household name. Jacinth, over to you.
Thanks, Stanley. Yeah, it was really traumatic. So I think I'm not the only one. There are a lot of parents watching right now who are feeling equally worried if whether their kids have contacted COVID or might contact COVID because they're going to school. So hopefully my sharing can help give you some insights on what I did. Okay, but hopefully you won't need to use any of those. So it happened last year in October, and like what Stanley mentioned, it was way before Omicron came. and I believe it was Delta. And at that point, there were not many kids who had COVID. So can you imagine when you suddenly see that double line on your kid's ART test kit, and you'll be really shocked, even though I've been reading about what we should do when we get COVID, but when it really happened, my mind went blank and my heart sank. I didn't know what to do. And at that moment, my first instinct, okay, so maybe I'll just share what happened. So it happened on a Saturday morning where we had prata, which is my son's favorite breakfast, but he couldn't even finish half a slice. So that was the first sign. And he looked very tired. When we were playing board games after, he didn't want to join us. He was just lying on the sofa. So I remember feeling him and touching his forehead, and it was hot. So we took his temperature. It was 38.7 degrees Celsius. At that time, I told my husband, let's test him. So we took the ART test kit and we tested him. At that time, I think the schools gave out quite a bit to the kids. And yeah, it was positive. It was really a nightmare for me. At that point, after we have kind of calmed ourselves down, we decided to call the GP, call the doctor. And the doctor told us to bring him down, but only at a specific time, because they didn't want the COVID and non-COVID patients to like mix. So at that time, we waited for a couple of hours. We were just distancing ourselves from him. And I have a little girl, and all I could think of, I mean, as parents, we'd be really, really worried about what happens to our kid who gets COVID. How do we separate the other one? And what if we get COVID? And how are we going to isolate the kids? And I think we are always, caring for our kids and worrying that, at some point in time, you wish you were the one who got it. So in the end, he went to the GP. My husband brought him to the GP. And at that time, there was the home recovery program. So when he was at the clinic, I knew that he would be at home because he's 7 years old. And I decided to clear the room because I know he's going to be isolated. And so basically I brought out my laptop because I still got to work, right? My laptop, my monitor, my toothbrush, my toothpaste, my clothes for 10 days. Because at that time, the recovery was 10 days. And one thing I think I should have done it was to remove all the unnecessary stuff from the room, because I had to clean them after. I didn't think about those. So if you have extra cushions, I had a lot of dried flowers in my room, I should have just taken them all out because I have to clean up after. Yeah, okay, so 10 days was a really long time, and I think kids are more resilient than we think they are. So my son was isolated for 10 days. So my husband could go in, but he has to put on a mask. We didn't want my husband to stay in for too long because he has to work and he has to help with my younger one as well. So if he's going to be inside for too long, I'm going to be alone with my younger girl and I have to work and take care of her at the same time, which is really a pain point for many parents now, I'm sure. So thankfully, his fever broke within 24 hours. So by Sunday, he had no fever, no loss of taste and smell, and he was active. So I thought that was a good sign. So another tip is to teach your kids how to care for themselves. So luckily, by then, I already taught him how to take his own shower, how to feed on his own. He doesn't really need me. But I'm sure if those of you who have younger kids, that might be quite challenging. So definitely an adult has to accompany the child. What does he do during that 10 days? This is very tricky because I don't want to give him too much screen time, but at the same time, I know he's going to be very bored. Can you imagine you're stuck in a room for 10 days without stuff to do? Yeah, so especially he's 7-year-old. So in there, we got him lots of books, Lego. He likes Lego. And we basically let him do his coloring, sticker book, stuff that can occupy him for a long time, and that would be helpful. Yeah, so we also use paper plates so that we don't have to wash it. And for his laundry, we had to wash it regularly at high temperature. So, and we had to change it every day because he didn't really have a lot of clothes to change. And we also use a different sponge to wash his water bottle. Yeah, so it is, now that I can recall, I can tell you very calmly, but really during that time, it was really horrible. 10 days I had to work, I had to take care of my younger one, I had to take care of him, and yeah, it was really bad. So I just want to be very real here. It's not going to be easy, okay? But it's over. Things are better now, and yeah, he has taken his booster shot according to the guidelines, which is 3 months after. Yeah, so all's good.
I applaud you, Jacinth. You survived 10 days, and now it's even shorter now for isolation period. So you really, endured through that period. So yeah, great tips there. You said books definitely were a way of keeping him occupied. Lego bricks. I'm surprised you didn't mention a tablet or an iPad, or you didn't give him any screen time?
Okay, I'm not for screen time, but I did give him his iPad. So I didn't put it in a room all day. So we have about an hour for him each day. Yeah. I think I kind of like train him to be engaged in non-screen activities, like a lot of reading. So we bought books from Amazon Prime that deliver the next day, like a whole set. I just pass it to him. But for screen time, I would like to share with parents that if you really need to, you need to maintain your own sanity. I think that's the most important. It's okay to let your kids watch a little bit more screen, but of course, just be careful. Let him rest his eyes, not put the screen too near, and also in moderation, not in excess. Yeah.
Right. I think a lot of parents may also be curious about how you went about disinfecting the whole apartment after your son came out of isolation for 10 days. Did you have to use any special detergent? Did you get commercial help maybe?
No, we left the room for 3 days before we went in to clean, because based on what we read, that after 3 days, the COVID, it would just die off on the surfaces. So that's what we did. So we didn't engage a company to do so, but I know of parents who do that. In terms of cleaning, okay, so when I talk about Lego, right? But maybe one thing I forgot to share is that don't bring in too many Lego, because the cleaning is a hassle. Like, especially the tiny parts, it's just very difficult for you to clean it up. So in the end, I have this parent who shared with me that we can use Dettol, warm water. So basically just soak it in warm water in Dettol. But one mistake I made was that I soaked it for too long, and then the Lego turned out very faded. So in the end, we just soaked, I think about half an hour should be enough, just dry in the sun. In terms of bolts, I actually spray it with alcohol, kind of, what do you call that? Sanitizer. They're the ones that vaporize very quickly. I think it's called Hygiene X or something. Yeah, so we just flip the book and we just spray it. But again, we didn't touch it after 3 days. So we should be pretty safe. Yeah.
Okay. Now, given all that you have lived through, what would you say are some key takeaways that parents can learn from your experience should their child, touch wood, get COVID-19?
I think we'll never be prepared. Like, you can tell yourself, okay, I know of so and so who got COVID, and I'm prepared. But really, when the time comes, it can be quite you'll be in shock and you won't know what to do. So I think very importantly, you got to stay calm. Know that there's a lot of information out there by experts that you can get access to, like this sharing. I wish I had this sharing then. There weren't many information about kids getting COVID last year. Yeah, so just stay calm and take a deep breath and try to find out what is the next steps. I think today's session is very helpful. The information can let you know what are your next steps. And also, I think we want to let our kids understand that the kids are going through a very tough time as well. So they might be throwing tantrums, they might be having, refuse to do whatever you tell them to. Know that it's very, very painful for them as well. So maybe can close one eye a little, give them their favorite foods to eat, their favorite drinks, let them play board games, let them do the things that they enjoy, and it will get by. 3 days should be manageable.
Yeah, don't take away the childhood that they are meant to have despite being in isolation. But something else that you mentioned was that your child has received the booster shot. So when it came to that time when your child was of age to be receiving the booster shot, did you have any concerns about whether or not to have your child or maybe your children have those vaccinations?
Yeah, like many parents, I think we're really concerned about the long-term side effects. So when we heard about it, part of me would be very, very worried. Like, what are long-term effects? What will happen to my child when he grows up? Yeah. So it was, we had a lot of conversations, me and my husband, and we were just thinking about whether should we get them vaccinated or not. And we realized that, we don't know the long-term effects of vaccination. We also don't know the long-term effects of COVID. So they're unknowns. And I think for us, we look at the research and the statistics have shown that, the risk reward profile of taking a vaccine is actually more favorable than not taking a vaccine. So in the end, we decided to have my kids take the vaccine, especially with the surge in the Omicron cases, just to protect them and do what we can within our control. Yeah.
All right. Well, thank you so much, Jacinth. We're glad that you survived, and wonderful words of advice there for our audience here as well tonight. Jacinth, thank you so much for putting in your thoughts about this whole experience that you have lived through. Now we're coming to our next segment where we would like to bring on our panelists. They're here to address your questions, and many of them have already come through earlier on, and we will be looking at some of them. Based on the questions that have been sent in, they have been divided, you could say, broadly into three categories. Firstly, COVID infection amongst children. Then you have the category of vaccination and boosters, which some of you might have questions on. And also getting tips for how parents can protect your children. So we can be looking at these questions that have come through in their respective categories. Once again, if you've got any questions, you still have time to quickly use the Q&A function there at the bottom of your screen. Submit your questions. Our panelists, given time, will try to address them as well. And let's move on to looking at some of these questions, shall we? All right, so looking at the first category, COVID infection amongst children. Let's look at the first question there. Are there any long-term side effects to my child if he or she contracts COVID? Dr. Chan, would you like to answer this?
Thanks, Stanley. Well, I think long COVID as a syndrome, which has been well described in adults, is actually rare in children. However, we do have some children who have longer symptoms that may take months to resolve. So things like the loss of the taste or the smell that can take a number of months. Some children will have inflammation in their liver, which we see on blood tests at the time when they have COVID infection, and that can also take months to resolve. And some children do have tiredness after the infection that does take some time to get back to normal as well. The other thing about having long-term effects is that if you do have severe COVID illness, or you have the complication of multi-system inflammatory syndrome in children, then these can potentially give you long-term serious complications.
All right, thank you, Dr. Chan. Now we've got another question, and that is for Professor Vernon. Now, when the ART results is negative on day 3, does this mean that one is no longer infectious?
Thank you so much. So I get a lot of these questions nowadays because, of course, COVID, especially with the Omicron variant, is quite common in our community, and we're trying to live with COVID, which means that a lot of us are actually doing ART tests at home. So ART tests, or the antigen rapid tests, are used to detect the presence of viral particles, and they're especially good at identifying individuals with very high viral loads. So which means that those who test ART negative after day 3 of infection are most likely to have lower viral load or non-infectious. So hence, if one tests ART negative, he or she can actually exit self-isolation and has a very low risk of infecting others. However, at the same time, I also have some people asking me, what if they want to take self-precautions? And because low risk sometimes doesn't mean zero risk. So if you want to have some self-responsibility, for example, if you're around vulnerable individuals, or you want to just stay away for 1 or 2 days extra, that's absolutely fine. But as long as you test ART negative, the risk is very low, you're likely to be non-infectious, and you can go about your life as usual. Thank you.
Awesome. Thank you, Professor. Now, I think a lot of questions with regard to recovery would also, be about whether or not we can accelerate the recovery process. Can that actually happen? That's the third question. What can I give my kids to ensure he or she recovers faster from COVID? Can we accelerate that, Dr. Chan?
That's a great question. I wish I had an answer to that. The short answer really is that there's nothing we can give them to make them recover any faster. It really depends on their own body, and every child is different. You can, however, make them feel more comfortable when they have the infection, right? So, having mild illness doesn't mean that you don't have any illness at all. And many children will have fever. Many of the younger children, when they're febrile, will have poor feeding. They'll be lethargic. Some of them may have vomiting or diarrhea, and you can help them feel better, allowing them to rest, making sure that they have lots of fluids to drink. If they have a sore throat, and sore throat is really very common now that we see with the Omicron variant. If they have a sore throat, it helps to give them something that they like to eat and drink, and something that goes down easily, right? Something cold, something soft, something that they will enjoy, because if they have a poor appetite, then they're more likely to eat and drink if it's something they like. And then I think lastly, simple medications for fever and runny nose, like paracetamol or some antihistamines prescribed by a doctor, those can also help the child feel a bit more comfortable in the first few days when they're unwell.
Thank you, Dr. Chan. Now, the fourth question in this category would be, what is the risk of COVID infection once my child is vaccinated? And also on the flip side, what happens if a parent may prefer not to vaccinate his or her child? Let's pose this question to Dr. Chan as well, or maybe Professor Vernon might like to take this.
Yep, I'll be happy to answer the question. So essentially, the risk of COVID infection is always present. But with the vaccination, you can actually reduce that risk quite substantially. I think Professor Raymond earlier shared that during the clinical trials, it was found that the complete course of the vaccine is shown to be about 90% effective in reducing infection risk. Of course, clinical trials and real-world situation might be different, especially when new variants emerge. So there are, for example, new data emerging that showed that the effectiveness against the current Omicron variant might be less. But let's not forget that even a reduction in protection still prevents some infection, and preventing some infection is better than not preventing any infection at all. The other thing we also have to notice is that the infection infection is a continuum. So many people with who are vaccinated get actually very mild infection, and that's actually what we want, in a sense, to prevent severe infections from happening. And the effectiveness of vaccination in preventing severe infection is actually very high. So what then is the effectiveness of getting, or the impact of getting vaccinated? You can prevent some infection, you can prevent a lot more against severe infection. Now, of course, what happens if you prefer not to vaccinate your child? Now, you know that COVID-19 is circulating quite widely now. So there's, of course, then a very high risk that your child will get infected, if not now, at some point in time down the road. And as we've heard earlier, getting COVID in an unvaccinated individual is no joke. You can actually get severe outcomes. So for anyone who wants to protect their child, I say weigh the risk, weigh the benefits. And if you look at all of those, it is much better to get your child vaccinated, because the benefits far outweigh any potential risk, especially against severe COVID-19 infection. Thank you.
Thank you for your input there, Professor. Now, still, we are looking at questions coming in from our audience today, and there's one from Lin Tan. Thank you for your question. You're asking, are we at the endemic stage of COVID at this moment? And it looks like you also have some foresight with the next question of yours. Will there be more variants coming up? Professor Vernon.
Yes. So this is, in fact, a very astute question. Right now, as you have seen the daily charts that we publish online, the cases are increasing, but it's increasing at a slower rate. That means that at some point in time, we will actually peak and cases will start to drop. This is how all sort of epidemic waves occur. You've seen this happening in many countries. Now, after this particular wave, that means that we are one step closer to living with COVID, and we will look very much to moving towards that endemic phase. Now, does that mean that we will have not, does that mean that we will not need to take any precautions? Now, I don't think so, because like many other respiratory diseases, COVID will be with us, very much say like the flu and other similar diseases. It is always appropriate to take good basic precautions. For example, if you are ill, stay at home or if you're out here to see a doctor, wear a mask, go and see a doctor, and take precautions not to expose yourself to vulnerable individuals. For vulnerable individuals, they might want to, sort of avoid crowded or high-risk places, or put on a mask for their own protection. And of course, then getting vaccinated, which is one of the key points that we're trying to put forward today. That's one of the very important things that will help us to move towards living with COVID in the longer run. Now, the other part of the question is, will there be future variants in the coming up? And I think the answer is that one cannot exclude the possibility of future variants, and it's very likely that future variants will come up because the virus is always mutating. It is a force of nature. The virus is always trying to find ways to survive. So when we come up with vaccinations, when we get infected and get immunity, the virus always tends to mutate, and those mutations that will provide some, in a way, fitness for it to survive will tend to then propagate and promulgate and will spread, and that's where we have new variants and so on. But fear not. I think as long as we are vaccinated, as long as we have the right basic precautionary and preventive principles in place, then we should be able to deal with future variants very much like we deal with Omicron currently, with a lot of self-responsibility and going to see the doctor if you have any sort of severe illness. Otherwise, you can actually do your own testing, stay at home, and be responsible not to infect others. Thank you.
All right. Thank you, Professor. We've got two more questions on this category of COVID infection among children, going through our Q&A list. This next question from Tan Shi Ying. Thank you for this question. You're asking about swab tests for kids. Is taking the mucus sufficient, or must we really dig into the nose? Totally understand, because I have a 2-year-old and we were initially worried about how a 2-year-old can stay still when you're trying to do the swab test and ART. So let's also look at another question from another of our participants. Can babies less than a year old be tested with the ART? If able to, are you able to advise on how to do it correctly? Dr. Chan, you might be able to weigh on this.
Right. I mean, those are great questions. And I'll admit that it is actually really quite challenging to swab young, small children, especially if they're kicking and screaming and, you need one person to hold them down and another person to do the swab. So I think the first thing is that there are 2 kits that have been recently approved by the Health Sciences Authority for use for children under 2 years old, which I think is Flowflex and the Abbott Pen Bio. The second thing is that for the very small ones, especially the under 1-year-old, sometimes it is difficult to do an ART because the stick is quite hard and quite thick, and you can't really get it up the nose to the right area where you want to get it. So sometimes for the very small children, for example, newborns, we would prefer the PCR swab instead, because the PCR swab tube is actually very thin and it's flexible. So it actually bends, it's not hard and stiff. So a hard and stiff stick is very hard to get into a very tiny nostril, whereas a thin, small, flexible thing is much easier to do. When you do the swab, it's not just the mucus you want to get. You want to get actually the cells of the nasopharynx or of the anterior nose. And therefore, you do kind of need to, how do I put this, scrape the nostril a little bit and not just take what comes out. So mucus comes out, you can't just collect that. You do kind of need the skin cells within the nose.
Okay, I've learned something new there. Okay, so the last one that I did for my 2-year-old child didn't quite cut it. All right, so a little bit more skin cells needed there. Let's look at the next category. I believe we've got quite a number of questions to get through, and this category is about vaccinations and boosters. Now, let's look at question 1. Are there any health conditions under which my child should not take the vaccination? This person's child has Kawasaki disease when he was 3 years old, contracted COVID, has recovered. Is vaccination safe for him? Dr. Chan, let's see if you can take this one.
Sure. So I think if the child is acutely unwell, and by that I mean, somebody who is febrile with a new illness in the last 1 or 2 days, then they should delay having the vaccine until they are recovered. Or if somebody has an unstable medical condition that's still being acutely managed, then again, we would say to delay it. And that's something that you can also discuss with the doctor who's managing the medical condition. But other than that, in terms of the ones who really should not have the vaccine, it's probably only those who have already had the first dose and have had a severe allergic reaction like anaphylaxis, or someone who's had the first dose and had a severe myocarditis, pericarditis reaction to that. But other than that, if you have had previous Kawasaki's disease, you've previously recovered from COVID infection, you can actually still go ahead and have the vaccine.
Okay, Dr. Chan, our next question is the COVID vaccine safe for a child that may have allergies? And besides having many allergies, children who have, say, asthma, G6PD, diabetes, sensitive nose, can they take the vaccine?
Yeah, so there's a whole spectrum of allergic diseases, which includes things like eczema, asthma, egg allergy, food allergy, multiple drug allergies. The short answer is that yes, all these children can have the vaccine safely. The only specific allergy where we say don't have the mRNA vaccine would be children who have an allergy to something called polyethylene glycol, or PEG. And this is a very specific component of many common products like cosmetics and creams and body lotions, things like that. So if you know you have a PEG allergy, then don't have the vaccine, but other children for all other allergies generally can.
All right, so there's that segment on allergies. Now let's move on to the third question with children who may have special needs, whether it's ASD or ADHD. Will the vaccine have any neurological effects on special needs kids, Dr. Chan?
Sure. So at the moment, there is no evidence to suggest that there would be any neurological effects for special needs kids. And in fact, we have vaccinated many children with special needs, and it's all gone very smoothly so far.
All right. And a question that we're pulling out of the Q&A would be a question that's come through regarding today's news report. I missed this one, even though I was reading the news today, but it's shared on the Pfizer vaccine being 12% effective against Omicron for 5 to 11-year-olds. Now, with this new info and stats on children in this group generally recovering well, will our views on vaccines for this age group change? How do we interpret the latest news that the efficacy of vaccination for this age group 5 to 11 is significantly lower than expected? Professor Vernon, would you like to take this?
Yes, thank you so much. So as I've mentioned earlier, there are many people doing various studies on the effectiveness of vaccines. So this is one study. It is an important study, but at the same time, we have to look at what other studies are being done and what is the effectiveness as shown by the breadth of information. I don't think we should just rely all our action on just one data point alone. Nevertheless, as I mentioned earlier, it is very likely that in some of these field studies, the effectiveness of the vaccine may be less than during the clinical trials. But nevertheless, it does show quite a bit of effectiveness. And I think the same study shows, I think, a 48% reduction, which is almost half a reduction of severe infection. So that's still quite substantial. And so I would still urge parents to get their kids infected. Get your kids vaccinated. Oh my gosh.
Vaccinated.
Don't get your kids infected, get your kids vaccinated. And it is still important because if your kid is infected after the vaccine, the chances of a severe infection is substantially reduced. And that's what we are really trying to prevent against. Thank you.
And since you made that slip up about getting them infected, it's not like having a chickenpox party, right? When you have your kids, get them all infected with chickenpox, and then you don't have to deal with it anymore. It's not the case for COVID.
No, it's not the case for COVID. In fact, like many other similar respiratory diseases, for example, influenza and so on, why we can get it repeatedly across our lives is because the virus mutates very quickly. And so those, for example, who had gotten infected with the original COVID strains 2 years back, with Omicron, for example, many of them got reinfected. So I wouldn't recommend getting purposely infected with COVID, especially if you're unvaccinated, because number one, the risk of severity or severe outcome is very high. Secondly, somewhere down the road, you can get reinfected with another bad outcome. However, if you are vaccinated, which means that, see, the vaccine is like training your body to produce a lot of these soldiers, right? These mini soldiers to fight against infection. And once your body is exposed and has that memory, the soldiers are there. They may be dormant, but they're there. And once you get exposed then to COVID, these soldiers are there to fight the infection. You get a much milder infection, but that exposure also then trains your soldiers to be even better. So with each subsequent infection after the vaccination, your soldiers are actually getting trained. And therefore, by itself, not that bad a thing. Although I wouldn't, like I said, go seek out infection because infection can be severe.
All right, yeah, wise words there. Thank you, Professor Lee, for that. Now, we still have more questions on vaccinations and boosters. Let's move on to the next slide on question 4. Will there be any developmental issues when children get their COVID-19 vaccination? And given the short history of COVID vaccines, how can parents be reassured, or maybe assured if they've not been assured before, of potential long-term side effects of mRNA vaccines? Dr. Chan, please.
Okay, right. So I think that's a sort of two-part question. I'll address the first part first. So the short answer is there is no evidence to suggest that there would be any developmental issues related to vaccination. And then the second part about the long-term side effects, I think actually Jacinth said it really nicely just now, which is that firstly, we don't know the long-term side effects of mRNA vaccines. We will only know that with time. But from what we know of the vaccine and how it works, we think that this is unlikely. For most vaccines, for nearly all vaccines, the side effects that we see tend to happen in the first couple of months after the vaccine. And so far, what we have seen from vaccinating many children, many adults, many adolescents around the world, we know roughly what happens in the first couple of months already. The mRNA that is in the vaccine is a synthetic mRNA. It doesn't contain the actual infectious virus. It disappears from the body within 2 to 3 days entirely. So it's broken down naturally and disappears entirely. And when you compare that to actually having the infection, when you get the infection, you get tons of virus in the body, lots and lots and lots of virus, which is much more than what you're getting from a vaccine. And I think the other point that Jacinth made is that if you do get the infection, you don't know what the long-term effects of that is going to be either, right? So again, only time will tell, 5 years, 10 years down the road. And I think you're balancing that with the risk of the long-term effects of the vaccine, which we think are unlikely. What we do know actually are the short-term risks of not having the vaccine, right? And that means greater risk of severe illness.
Again, driving back that message that the benefits outweigh the risks in whichever case it is. Now, the next question.
If I can just add, if it's possible, just for me to add to that question as well.
Go ahead, please. Yeah.
Because I think a lot of parents are rightfully concerned about vaccinating their kids, especially with what is supposedly a new vaccine. But in addition to, I think what Dr. Chan has said, which is very pertinent, I think in addition, mRNA vaccine as a technology has in fact been around for many years. And the development of the mRNA vaccines this time has actually undergone the full, a robust development cycle. It's very quick because there's a lot of collaboration between the pharmaceutical companies, governments, and also regulators, because this is a global pandemic, and that's why the release of these vaccines is so quick. And also the clinical trials have proceeded very fast, not because they're any less robust. In fact, they are very robust, covering tens of thousands of individuals. It's because during a pandemic, there's so many infected people who actually, raise their hands to volunteer for those clinical trials. And that's why we managed to get so much information in a very short period of time. And the last thing I wanted to also point out is that unlike many other new vaccines, for the COVID vaccines, in fact, millions, if not billions of people have already received these vaccines. And you can see all the evidence that has shown that the side effects or the risk of the vaccine actually is quite mild or quite low compared to the actual effect of getting COVID. And I think like Dr. Chan has pointed out, if you're worried about the long-term side effects of mRNA vaccines, which actually we know biologically actually disintegrates in your body very fast, and there's actually no lasting component of the vaccine that remains in the body for the long run. But we know that getting COVID infection does have issues of long COVID, and who knows what other effect it might have in the longer run. So if anything else, I would take my bet with the vaccine. Thank you.
Thanks, Prof. Now, the next question about one of our audience members, daughter, 11 years old, took her first dose, had some effects, chest pain and breathlessness for the first 2 days. And I suppose if you were a parent of such a daughter, you'd be worried about the second dose and maybe the booster, right? What kind of other effects she might be getting? So Dr. Chan, how would you advise on how the parents of this girl should be able to approach the second dose maybe?
Yeah, so I think that the first step would be to find out why she had chest pain and breathlessness. So I think chest pain and breathlessness are symptoms that we do look out for after you've had a vaccine, and we would advise to see a doctor so that that can be assessed. The most serious thing that we would consider for chest pain and breathlessness would be something like myocarditis or pericarditis, which is inflammation of the heart muscle. But actually, if the child's recovered well, the chest pain and breathlessness went away on its own, there was no other long-lasting sequelae, it's very unlikely to do that. We do see some children who have very non-specific symptoms after the vaccine. Chest pain is sometimes very non-specific, sometimes it's musculoskeletal. But I think the idea here is that I can't tell by reading a question why she had chest pain and breathlessness, and therefore the important thing is to see a doctor so that it can be assessed.
Right. Thank you, Dr. Chan. Martin, thank you for joining us tonight. This is your question for our panelists. You tell us that you have a 5-year-old who is about to have his vaccine next week. The usual advice, of course, we've all heard is do not exercise for up to 2 weeks after the jab. And you're asking what this means for your child whom you say looks to be pretty active, who likes to run and play. Should you stop your child from running and playing? Or maybe there's just less risk of someone who is so active being impacted if they were to continue doing that exercise. Dr. Chan?
Yeah, so I think we generally advise to avoid strenuous exercise, the focus here being on strenuous. So we're talking about things like jogging, maybe cycling for long distance. We're talking about swimming classes where, you're trying to beat the clock because you're training for swimming competition. So I think in general, things like tennis, racquetball activities. So I think strenuous physical exertion, we would say to avoid, but the normal kind of run and play, in the playground or in the house when children are just running around the house crazily, chasing each other, that's all fine. That's kind of normal physical activity for a child.
Okay, looks like we might have a new Joseph Schooling in the making there. Final question with regard to vaccination and boosters, question 6. Apparently, Sinovac is given to younger kids less than 5 years old in some countries. Question is, will Singapore consider implementing the same for kids less than 5 years old here who have no vaccine option at the moment? Let's see. Who would like to take this? Professor Vernon?
Yes, thank you so much for that question. Again, a very relevant question and one that many parents have also been asking me. So the use of vaccines for younger children is being studied in clinical trials in many different settings. Of course, different countries have their own considerations on why they roll out certain vaccines. In the local context, our Ministry of Health, in consultation with our expert committee on COVID-19 vaccination, will continue to examine different vaccine strategies, including vaccines for use in children less than 5. And we actually use our own risk-benefit assessment for the relevant subpopulation. Like I've mentioned earlier, we have done risk-benefit assessments looking at all the data for the older age group in children and also for adults and the elderly. So currently, we are looking at this data and also the evolving situation. And when we have sufficient data and we're able to make the recommendation, we will certainly do so. So stay tuned on this space.
All right, thank you, Professor Vernon. Looks like time is flying by. We have a lot of questions. We wish we could get through them, but let's move into our final category, shall we? Our final category, which would be about tips that we can leave parents with regard to protecting their family. Now, the question would be for the first one in this category, your son isolates himself in a room most of the time. How do you prepare him since he is still pretty young? All right, Jacinth, it looks like this is a question directly up your alley.
Yeah, so what helped was to tell the kids about COVID even prior to him contracting COVID, to tell him what it is and what could possibly happen. But I think in the moment, we want to focus on the positives, let the child know that at least you're at home, you can still see us, versus you have to go to maybe another facility. And also, it helps to always check in with the child. So even though the child is isolated in the room, we have our talk. We talk to him, at least every night before we go to bed, and it is a session that he looks forward to because he can look at us. We try not to go too close, about 3 meters apart, so we're like screaming across the corridor. But I can tell that it's hard for him. So there are times that you can see him like tearing, And actually, there was one episode when he actually spilled his cereal on his own and he broke down. So I'm glad that he actually broke down, because once he released it, actually felt much better and was more optimistic. So I think it's important to talk to your kids about how they feel and check in with them. And there's this ebook, right, on what to do when I get COVID. Yeah, I think it's a free ebook that parents can actually just download and read it to your kids now. Yeah.
Okay, that's definitely helpful. This next question also would be for you, Jacinth. How do you prepare and explain, because it was your son who had COVID-19. I believe they're quite close, the siblings there. How do you explain to your daughter, don't go near Koko? Koko, right? Not Titi,
Yeah.
Koko. Okay.
Yeah.
Don't go near Koko because, he's got COVID. How do you explain that to her?
It's hard. They're always so close, and there are times when she'll forget, she'll just automatically just go over to him. So what I did was to put a tape on the floor, like a boundary, so that she knows that she should not cross the line. But other than that, it's a lot of reminders, and maybe also to keep my girl occupied outside, so that she doesn't need to have to go near the big brother.
All right, thank you so much, Jacinth, for your input there. This next question, my girl is 16 months old. We can't keep her always inside at the apartment. We need to take her out to play. I totally understand traveling by public transport, and you can't control what she touches. Again, totally understand, they're young children, they don't understand. And the question is, what are the precautionary measures in which this parent can take to protect the daughter who touches everything? How can I prevent my unvaccinated children who are below 5 from contracting COVID? Dr. Chan.
Yeah, 16 months is young, right? Difficult to control. I think it's constant reminders. So it's constantly reminding your children about hand hygiene, cough etiquette, wearing your mask, don't touch the outside of the mask, and to try to play in small groups or at least in regular groups of friends. Young children learn very quickly by copying. So if the adults can also model the same behavior, it helps to instill that kind of discipline and habit in the child. And generally, once it becomes a habit for the whole family, including the adults, then the children do comply to that much better. I think the other basic things are things like, if you're sick, please stay at home, right? So if there's an older child, who is coughing and unwell, stay at home, don't go to school and spread it to the younger kids who are unvaccinated. And then lastly is, to vaccinate the family members who can be vaccinated, because they are less likely to bring that infection home and spread it to the younger child who can't be vaccinated. And we're seeing that very often nowadays. We're seeing school-age children who are unvaccinated getting infected in school, coming home and spreading it to the 1-year-old or the 18-month-old who's at home, not in school, but is exposed to the brother or the sister at home. Yeah. So vaccinate who you can within the family.
Thank you, Dr. Chan. All right, I think we still have some time. So let's go back one slide before, still talking about vaccinations and boosters, which a lot of our audience members have today. The next question on a child contracting COVID-19 before getting his first jab. What can this child do for his first jab after recovering from COVID-19? Does he need to get 2 jabs as well? Professor Vernon?
Thank you so much. So yes, indeed, a lot of questions about infections, jabs, and boosters. So essentially, if your child has a confirmed infection, he's recommended to get 1 additional jab 3 months after the infection date. And why we say to wait 3 months is so that the body has time to build up some substantial immunity, so that the second, when the jab comes, the immune boost or the immune increase will be quite substantial. We were talking about the soldiers analogy, right? Your soldiers had just gone through 1 round of training, and after training, we are sometimes all a bit tired. We need to have a little bit of rest before the next round of training comes. If you keep training your soldiers every day, after a while, the training may be less and less effective. So you want to wait for a little period of time. So 3 months is what we would recommend. So that's the answer. You get 1 jab after 3 months after infection.
Okay. The next question, in a similar vein of vaccinations, a child had COVID-19 recently. He had already taken 2 doses of the vaccine. Does he need a booster? Because this parent has been told that it was recommended, but not necessary, because by then, after getting COVID-19, you have stronger antibodies. Is that true, Professor?
Yeah. So for children from 5 to 11 years old, at this point, there's no recommendation for a booster. We are still reviewing the evidence. But for the older children, age 12 and above, after they have completed the recommended COVID-19 vaccination, the 2 doses of vaccination, and they do get infected, currently there's no specific recommendation to get a booster. But like I mentioned, if they wish to get a booster to get additional protection, they may do so, and it is safe for them to do so. In fact, many individuals out there sometimes do get COVID infection without even realizing that they have gotten infection, what we call an asymptomatic infection, and it is extremely safe for them to get vaccinated or to get boosted.
All right, thank you, Professor. Looks like we already have answered question 9 about whether or not the recommended duration between the second jab and the booster will be 3 months. I believe that's already been answered. That is true.
That's correct. So what we say is that if they come anytime after 4 weeks or 28 days after the infection, we can actually give the vaccination, but the recommendation is about 3 months, so that, as I've mentioned earlier, your immune system have had time to sort of rest, recover, and get the full benefits of the vaccine. Thank you.
All right, Professor Vernon, and also our fellow panelists, Dr. Chan, and also we'd like to bring back Professor Chua. Let's get your final words of encouragement for our parents tuned in. Still a lot of concern about getting vaccination for their children, how to deal with COVID-19 situation, especially if the child contracts COVID-19. What sort of words of encouragement would you like to leave our audience today? Dr. Chan, we'll begin with you, and then we'll move to Professor Vernon and then Professor Raymond. Dr. Chan?
Right. I think that in general, most parents, if they have the opportunity to protect the child from being unwell enough to need hospitalization and serious illness, however uncommon that may be, that is usually an opportunity that most parents will want to have. And at the moment, vaccination seems to be the best opportunity to protect children from that, right? Omicron is highly infectious. It is everywhere in the community now. Many children are getting it. And right now, the best protection for that will be vaccination, so that they don't become so sick that they need to go to hospital. Yeah.
Thank you, Dr. Chan. Professor Vernon?
Thank you. So thanks everyone for having us on this panel. So just wanted to say that I think as parents, we all want the best for our children, and to protect ourselves against COVID-19 is not just one strategy. In fact, it is what I usually call the Swiss cheese approach. You have many layers of strategy. None of those strategies are 100%. There are little holes in them. But if you layer all those together, you can actually provide a very solid barrier. So the 3 main strategies are vaccination, good personal hygiene, and also our safe management measures such as wearing of masks, distancing, and so on. But as you've already heard, for children, some of these things are actually quite difficult to achieve. Wearing of masks, having maybe good hygiene in certain circumstances, although we try to inculcate as much as possible. So to protect our children, vaccination is actually a very key component of that strategy. So look at all these different strategies, do the best you can, and protect your children. And we are here to support and to help you as much as we can. Thank you so much and have a good day.
I love that analogy of cheese. All right, so I think that will help, the messages stick even tighter. Let's also hear the final thoughts and words of advice from Professor Raymond Chua.
Yeah, thanks, Stanley. And I think Vernon has said it all, summarized it very well. There's actually a lot of strategies that we have put in place, to prevent someone from being vaccinated and to prevent someone from getting severe illnesses. I think, vaccination still remains the key, strategy that we think, will be important for you to protect your kid, if despite, good safe management practices as well as infection controls, if he or she still gets it, it will prevent your kid from getting severe infection. And I think that is what, we want for everyone, to collectively get vaccinated. Once we have good vaccination rates amongst the kids, the schools or the preschools that you go to, the playgrounds that you go to will collectively become safer. I think, and if you have any kids that are above 12 to 17, similarly, to get them boosted if you already, if their last dose is 270 days and before. I think, that's where we hope as a ministry, as one Singapore, we all collectively put our kids at a safer place by getting everybody vaccinated and boosted. So thanks again, everyone, and please continue to keep safe and healthy.
Thank you so much, Professor Raymond Chua. We also heard earlier from Professor Vernon Lee and Dr. Chan Si Min, all who have generously donated and contributed their time and their inputs and advice on this matter of dealing with a pandemic, especially with our loved ones like our children in tow. Also, a big thank you to Jacinth Liew, who's been our panelist as well, for sharing your own personal journey of coping with COVID-19, especially as your son was dealing with it. I'd like to thank everyone today for joining us in today's webinar, and we hope that this has definitely been insightful, has been helpful in helping you understand how you can better protect your family through this pandemic. It is a new normal after all. And before we share the names of the winners of the vouchers, we'd like to do a final poll. If this question looks familiar, it's because we asked it earlier, if you remember. We really want to see if we have managed to shift any opinions, if you have had a change of heart and mind after hearing the advice and sharing of our panelists this evening. So we invite you to check the box there. Will you let your child have the COVID-19 vaccination when it's his or her turn to do so? Meantime, I would say that I've definitely learned a lot. I have a 2-year-old myself. We even went on a cruise recently, and he had to do a swab test before boarding, and we were like, "Wow, is he going to be able to sit still?" But thankfully, he did. It wasn't just mucus, like Dr. Chan had said. Some skin cells would be needed, so thankfully he sat through that. So very strange times that we live in, and our children have to adapt to it as well as much as we do as parents. So 加油 to all our parents joining us today for this seminar. So, all right, let's see. Aha! I think we have got more yeses now, right? I believe so. Thank you for your inputs. We're glad that this has been an insightful and informative session for all of you who have joined us for this seminar. Now, don't forget also, you can scan the QR codes here. They'll definitely be very helpful as to lead you to more resources from the Ministry of Health, where you can find out more about vaccinations, about COVID-19 and its effect on children, and what you can do about it, really, the vaccines, the boosters, the efficacy of all of them. Now, the Singapore Parenting Festival 2022 is proudly presented by MediaCorp as well as the Asian Parent. Now, this festival is made possible by our partners. I'll mention them to you right now again. Hydroflux, thank you, Yu Yang Sang. Our co-partners, Dumex, Scott's, PCF, Sparkle Tots, Nature One. Our silver partners are Ministry of Health Singapore, Baby Dove, Virtus Fertility Center, Prudential, and our content partners, Center for Fathering, Mums for Life, Dads for Life, as well as Baby Pass. And now I believe it's time to reveal the winners for the $50 Shopee voucher. I wonder what you could be getting if your name is on that screen there. Congratulations to Wei Ling Chiang, Martin Lee, Daming Lee, Radiana Ahmad, Siti Zulaiha Rahim, and Fan Fong Chong for that win of a $50 shopping voucher each. Please take note of the email address there on screen, campaign@tickledmedia.com. Please email them your name, contact number within 3 days in order to claim your prize as well. Once again, congratulations to our winners. This is not the final evening where you're going to be enjoying a seminar that's been insightful and informative. There will be another one coming up tomorrow that will be hosted by my colleague Susan Ng from CNA 938. And I invite you to join her for this next seminar. It will be titled Ensuring Your Family's Well-Being. So in order to register, it's very simple. Again, look at that QR code right in front of you, scan it, and then make that registration known so that they are able to expect you tomorrow evening at 7:30, same starting time as this evening's session. All right, thank you so much for joining us. We have come to the end of our session. I believe we've even overrun it, but just because we want to address as many questions as we can. Again, thank you to our speaker and panelists for their time tonight. I'm Stanley Leong from CNA 938, wishing you and your family a safe and healthy years ahead. Thank you for joining us. Good night.
Thank you. Good night.